Good morning and a warm welcome to Alder Hey Children's Hospital for your Paediatrics B Year 4 2023 to 2024 cohort for the University of Liverpool. I am Dr. Joyce Lim, your Year 4 lead for Paediatrics at Alder Hey Children's Hospital. During this morning's welcome talk, I will aim to cover what students want out of this placement, as well as what the University of Liverpool expects of the students via the e-portfolio. At Alder Hey, we can help you with your 3 Ps: professionalism, preparedness, and punctuality. Here at Alder Hey, we have a very strong and helpful medical education team headed by Helen Blackburn and supported by Lindsay, Natalie, Liz, Jamie, and Carol. The medical education team representative will be based outside Lecture Theatre 4 at the Institute of Education during your placement here. So what do students want out of this placement? Feedback from previous groups of students have indicated the following, and I'm sure you have similar wishes as well. They want to gain more exposure to pediatric history and clinical examination, especially in the younger children age group. They want to build on experience in Year 3 pediatrics. They want exposure to multidisciplinary work teams. They would like introduction to some pediatric specialties, as well as, most importantly, to fulfill the university requirements for the Paediatrics B placement. We hope to provide you with the necessary exposure and experience via 1, the general week, as well as 2, the specialty week. Apologies for this rather busy slide, but briefly, you will be divided into 8 different groups, with 1 week being your general week and the other week being your specialty week. Within your general week, you will be timetabled for 2 clinics, 1 day case, 1 ward round, 1 A&E on call, 1 MDT, as well as 1 pharmacy ward shadow. Whereas during your specialty week, with your ESS team, you will have activities which include clinics, ward round, MDT, specialist investigations, as well as 1 on-call evening. During your 2-week placement in pediatrics, you will have formal teaching in terms of your pre-placement primer, which you will have already completed the Friday before the start of this rotation. You will have 2 CBLs, namely pediatric rheumatology as well as hematology, and pediatric neurology and end-of-life challenges. You will have placement clinical skills, which include pediatric basic life support. You'll have safe prescribing. You'll have pharmacy teaching on a Thursday afternoon during your general week, and you'll have a series of online lectures which we hope you will complete during your academic week. In terms of tutorials, you will have Day 1 placement induction session, as you have today. You'll have the 2 CBLs, and it'll be useful if you read the material provided before the CBL to gain most benefit out of it. And please try to read around the topic before the CBL and recap after the CBL in terms of your own self-directed learning. In terms of bedside or bedside style teaching, you will have 2 sessions organized by your educational supervisor. The aim is to see a case on the ward or in clinic and discuss about the case by the bedside or away from the patient. To benefit most from this bedside style teaching, it may be useful for you to read more about the cases after the teaching in terms of self-directed learning. You will, as I said before, have clinical skills teaching as well as pharmacy teaching as well. It is hoped that with these planned sessions that you will easily fulfill your e-portfolio requirement for Paediatrics B. All of you will have had access to the requirements shown here. Let me elaborate this further. During your 2 weeks in Paediatrics B, with 1 general week and 1 specialty week, you will need to complete a minimum of 2 cases of CPAT, a minimum of 2 examinations of OE, complete some of your DOPS procedures, complete 1 reflection form for untimetabled activity, to have attended 2 ward rounds with student declaration, to have attended 2 clinics, to have attended 1 half-day theatre and investigative experience following a patient journey, 2 on-calls, 1 in A&E and 1 medical or surgical on-call, have attended 2 multi-professional working, attended a series of tutorials including the placement induction today, 2 CBLs, 2 bedside style teaching session, the Paediatric BLS, as well as safe prescribing. You will have 2 education supervisor meetings, with the first during the week 1 and the second towards the end of the placement, the slightly different scoring system as compared to previous years. It is important that the student doctor comments and reflections to be completed prior to the first ES meeting. In terms of CPAD, what you should have for your e-portfolio are at least a minimum of 2 CPADs to be completed, with a recommended 3. You are to record a range of cases, including those with growth problems, abnormal movement, like musculoskeletal or neurological issues. Please remember that you must include at least a child with complex needs, i.e. a child with multiple medical issues. You could also include a child with chronic conditions like asthma, cystic fibrosis, diabetes, epilepsy, or chronic cardiac condition. These cases can be done during ward time, and you have to choose from cases during your ward rounds or during your on-calls. And please remember to ask the sister in charge of the ward or the nurse in charge of the patient before seeing the patient. The cases then are to be written up and to be presented to the doctors or A&P of different seniority or to your educational supervisor. Please be reminded that at least 1 CPAD needs to be signed off by an ST3 and above. In terms of your observed examinations, you would need a minimum of 2 OEs to be completed, but it's recommended that you have 3 if possible. They must include at least 1 patient aged less than 36 months of age. This can be done during bedside or bedside style teaching. It can alternatively be also done after a ward round, where you can ask the sister in charge of the ward or nurse in charge of the patient before seeing the patient. You can also do this during your A&E attachment, during your on-calls, or in your clinic. Please make sure that at least 1 OE is signed off by the ST3 and above. In terms of procedures where your DOPS form are to be filled, you are advised to try to do some basic wound closure, wound care and basic wound dressing, to measure child growth, to learn or demonstrate inhaler technique, as well as do some peak expiratory flow rate or PEFR, to collect some urine samples, to do some plaster cast application and removal. This can be best done in A&E or during on-call. To participate in surgical scrubbing up in theatre if possible. To do some swab taking, urine analysis, as well as to take some vital signs from the children. In terms of ward rounds, you're expected to attend at least 2 ward rounds. It also may be helpful to read about or around any interesting cases that you see during the ward rounds. It will be helpful to think about 3 new things that you might have learned during the rounds. There's opportunity always to go back to see any interesting patients for your OE or CPADs during ward work time. There's also opportunity during the ward rounds or afterwards to do some DOPS in terms of urine analysis, swab taking, as well as taking vital signs. Clinic-wise, you will have been allocated at least 2 clinics, but if you can attend 3, that would be recommended. It is always helpful to read around or about any of the interesting cases that you have seen in clinic. There's ample opportunity to do DOPS in terms of child growth measurements or recording. inhaler technique demonstration or PFR measurement, to take vital signs as well as urinalysis during clinics. And of course, there's ample opportunity to do clinical examinations to fulfill your OE forms. For your theatre or investigative experience, you will need a student declaration for them with at least a minimum of one student declaration. You should ideally follow a child on a patient journey during your half-day theatre investigative experience. There are also opportunities to do DOPS like wound closure, wound care, and surgical scrubbing during this. It also may be helpful to read around or about any of the interesting cases that you have seen. Please be reminded to change into theatre scrubs, have your shoe covers on or appropriate theatre shoes. Your hair is to be tied up neatly and tucked into a blue hat. A special hat is also available for those with facial hair or beard. And remember to wear a mask and to be bare below the elbows. And please remember to ask if you are unsure. You will each have 2 scheduled on-call activities, one in A&E from 12 to 9 p.m. and another medical or surgical on-call between 5 to 9 p.m. Each of you will have one on-call A&E placement. On the day of your A&E placement, please remember to be on time. At 12 o'clock on the day, you'll be given a 10-minute teaching at A&E. This will be followed by watching an A&E video after the teaching. At 1 p.m., you'll formally sign in at A&E. Between 1 to 8 p.m., you are free to take history, review your patients, follow a patient journey, do any available DOPS if possible, and also to present cases to the ST3 and above to complete your e-portfolio requirements. And between 8 to 9, hopefully you'll have time to write up a reflection using your university reflection pro forma. For the multi-professional working section, you'll be expected to complete student declaration. We need at least 2 of these. You would have been allocated to either a plate specialist, the ward pharmacist, the pediatric dietitian, nurse specialist or advanced nurse practitioner, as well as attendance at multidisciplinary meeting. At these meetings, it is hoped that you can observe how the meeting is conducted, how the members of the team contribute towards the decision making, as well as observe some rather complex cases being discussed. For your e-portfolio requirement, please remember to complete your student reflection on untimetabled activities, for example, CPATs, OE, DOPS, and A&E, with a minimum of 1 per placement. Your education supervisor will review this during the final meeting and feedback. Your placement evidence attachment will be able to be seen by your educational supervisor to make sure that there's at least the minimum requirement that is met. At the end of your placement, feedback and marking will be made based on unsatisfactory, borderline, satisfactory, good, or excellent. I'm sure all of you will be very keen to find out how you will be marked or assessed. The university has given new ES guidelines on marking, and they can be broadly divided into unsatisfactory, borderline, satisfactory, good, or excellent. You can have a look at this on your PebblePad e-portfolio. There's a new feature on your e-portfolio, which is called Collections, which allows you to tag the forms to go directly into your collection. In terms of your placement attendance recording, please remember to sign in each morning and sign out at the end of each day. There will be no exceptions accepted from the university, and the university will not entertain any retrospective appeal. If you miss more than 20% of your placement, i.e. attendance is less than 80%, then you will need a formal catch-up. The form is on Canvas. If you miss less than 20%, i.e. your attendance is between 80 to 100%, Students then can complete any outstanding e-portfolio requirements during their own self-study time. If there is need for catch-up or repeat placements, if you fail a placement, then it's usually at the end of the academic year. If it's significant absence, then it is a time that is designated by the university year team. Usually it's around the Easter break time or a mutually agreeable time at a later date. This then needs to be completed on a separate form on your e-portfolio. With respect to your ES meeting and feedback, during week 1, you'll have an introduction with your educational supervisor. He or she will go through the e-portfolio and its requirements. And during this time, you will also be given the opportunity to present any CPAT cases if necessary, and to review any potential issues that may arise or have arisen during the week. During week 2, again during the ES meeting, there'll be review of any potential issues. You will again allowed to present any CPAT cases that you wish. The education supervisor will review your e-portfolio to make sure that all your requirements are fulfilled, and then to complete the feedback. Please be reminded that if the ES meeting is delayed or does not happen, then please let the undergraduate team know as soon as possible. Please be reminded that the e-portfolio sign-off is done promptly by the end of the second week of your placement in pediatrics. If there's any planned delay in sign-off, you will need to specifically discuss this with your individual educational supervisor. The undergraduate team at Alderhay are here to help you. Please ask if you're unsure about anything. There will be a staff desk in front of the lecture theatre 4. If there are any sessions that are missed or cancelled, please let the undergraduate team know as soon as possible so that alternative sessions can be organized. Please remember to sign in the morning and sign out at the end of the day, as this cannot be retrospectively confirmed. Any absences should be informed to the undergraduate team as soon as possible. In terms of the ES teams that have been allocated, if there are any issues that arise, please let the undergraduate team know as soon as possible. Also, remember to check your timetable or timetabler regularly in case of last-minute changes. Below are the contact details for the undergraduate team, the Year 4 lead, which is myself, and the clinical subdean, Mr. Adam Dunn. You can alternatively also approach the member of staff in front of the lecture theatre 4 in the morning. And finally, we hope that you will enjoy your experience here at Alderhay Children's Hospital. A lot of the skills that you have already learned before are transferable to pediatrics and vice versa. Remember that babies and children are very interesting and not at all scary. And perhaps we may yet make future pediatricians out of all of you. Thank you and enjoy your Paediatrics B rotation.